My name is Natalie. My name is Natalie Huckins, and we are going to talk about back to basics, finding your home. A lot of people have already been in the PSH, CST training that I've done. And just if you can put in the chat, and Alex, just let me know, please, if you don't mind. Alex is my coworker. He's monitoring this for me and recording this. How many people have gone through the CST, PSH training, permanent supportive housing training? How many people? If you have, just say yes or no. If you haven't, say no. If you have, say yes, just so I can get a general idea, because I'm going to be going over some of those things that we talked about in that training. So, Alex, do we have, how many yeses? We have a lot of yeses, or mostly no's, or even?
It looks pretty even.
Oh, okay, cool. That's good. So some of this will be familiar to you. Some of you, just one part of it will be. The rest of it is going to be maybe things that you already know. So when I talk about back to basics, you guys, here's what I'm talking about. I am talking about, honestly, I've been doing this for more years than I want to count. So you have to understand, I started doing this when we didn't have social serve, when we didn't have any go Section 8 and all that stuff. So the folks back in my day, we just used what resources we had available, and they worked. We were able to house people. I can't remember anyone actually being homeless because of lack of me trying. There were some people, it took longer for some other than, for others because of barriers that you all are probably very familiar with. But let's just talk about the things I used to do back in the day. And I'm not even going to tell y'all how many years, but back in the day. So we're going to get that. We're going to do the basics, what I call the who, what, when, where, why, and of course, how. To me, these are all very, very important elements when you discuss with a member housing. First and foremost, I do want to say this. If you're going to be spending time seeking housing for someone, you all please have it on their PCP. Please, I have asked for PCPs, or I've looked at PCPs because we can see them in Alpha, that don't have a housing goal, but people are working on housing. So please make sure that's one of the goals, okay? So we're gonna go over each one of these individually. So the first one is the who. Who will be involved in your housing search? And when I say your, of course, I'm talking to the member. So you can either speak out or put it in the chat, who's gonna be involved in the search. If you don't have the key players, then you're already lost. So who will be involved? If you all want to just shout out some people. And I know y'all woke, I know you guys are awake. It's not that early. Not that early. Anything in the chat? Okay.
Yeah, so people are saying community health worker, the member themselves,
Correct.
housing specialist from the team.
Okay, good. Thank you for all who responded. So yeah, the member, numero uno, they are first and foremost. They are the primary player, or like I've been saying lately to people, they're the main character, okay? We're supporting actors and actresses, but they are the main player, okay? Then someone said the provider or housing specialist, that's still part of the provider network, correct? How about family? Is family involved? I mean, sometimes they are, sometimes they aren't. But if this person has a strong connection with their family, it is essential that the family is involved. Not saying they get to make any decisions or anything, but to be there for support. You want to have them there for support. What you don't want to do is have family members who are toxic to this member, because Alex can tell you one of the primary reasons people lose housing is for unauthorized guests. and many times those guests are family members who literally take advantage of the housing that we've secured for the member. I've even seen it where family members will come in and take over the housing, literally kick the member out and live in the housing. That has happened. So when we say family, make sure it's someone that the member, it's a healthy relationship. I'll put it that way. It needs to be a healthy relationship. Also, sometimes people have friends. If they don't have family, or even if they do, but a lot of people who don't have family, they have friends who are just like family and who they want to be a part of this process. All of this is dependent upon the member and what they're sharing with you. Okay, so you want to know who all is going to be involved. If they're connected to a church or a faith organization, you want to make sure if the member wants them involved, that they are involved. Often the faith community will provide furniture, clothing, utility assistance, all kinds of things. So don't leave it out to just ask them, is there a faith organization you're connected with that you want to be involved to help us, with your housing, or that you want to share information with? And of course, all of these people need to be on the release of information. They have to be listed so that you're, covering yourself, and that the member has told you you have permission to discuss housing with them. And then there's peer support specialists usually work one-on-one. They're the ones who the member can relate to. They're the ones who can share or self-disclose as much or as little information as they want on their own experience trying to find housing. Okay, so that way they can have that trust factor. You want to have that rapport with somebody. So peers are usually the ones that they start to trust first. So the what is it they're looking for? You want to know, do they want a little place in the country somewhere? Do they want to live in the city? Or do they just, maybe have an apartment instead of a house? Some people want a single unit. But when you talk about having a single standalone home, you have to understand that HUD has guidelines on the fair market rent. How much will HUD pay? What is the limit? And then if it's a single person and they're telling you that they want a house, you have to do a waiver to justify why the single person needs this 2-bedroom house. I'm going to tell you right now, if it's a 3-bedroom house, the chances are very, very slim that HUD would approve it. And some people will say to us, well, I'll pay the difference. But that's not how it works, because we're in the market to help people find affordable housing. If we allow a person to pay out of pocket something that is far above the fair market rent, we are not supporting them. What we're doing is we're setting them up to possibly fail. And we don't want to do that. We have to help them somehow understand that we have boundaries and guidelines. And honestly, it's for their own good. Okay. So if they want a single standalone home, think about everything else that's involved. Some people may want an apartment. This is a good one. First floor unit. A lot of people don't ask that question. When you're looking at these apartments like the one in the picture with the 3 stories, if that person has to be on the 3rd floor, or if they think they want to be on the 3rd floor, challenge them a little bit, respectfully, but challenge them. So let's say that, and this is an example I'm going to use that one of the providers used in one of the trainings I did. He had a member that insisted he wanted to live on the 3rd floor. He wanted to live on the 3rd floor. He wasn't always that steady on his feet. So the provider was trying to sort of gently convince him, how about a 1st floor, or at the very least 2nd? Well, he wanted the 3rd floor because he didn't want anyone above him. He didn't want anyone below him. So what this provider wisely did was one day, and of course this is pre-COVID, one day he put a bunch of bags, like grocery bags filled with stuff in the trunk of his car. And they went to one of the units, one of the properties where the member said he wanted to live. And the provider had that member tote those bags up to the third floor. What do you think happened by the end of this little experiment? Anyone can just unmute if you want to talk. What do you think happened?
He didn't want the third floor anymore.
He didn't want the third floor anymore. Why not?
It's a tough trip.
Yes, he toted those bags. He was sweating. After that, he didn't want the third floor. Now, my daughter, she's looking for an apartment right now, and she's always lived on the third floor. And I've always told her, don't expect me to come there all the time, because I'm not going up those stairs. I used to have to inspect units. And at one point, I worked for the city of Raleigh and I had to inspect them. So we had to just randomly pick some units, and it had to be on every floor in each building. So when I had the third floor, that was tough, because at one point I had pulled my Achilles heel. Now, I don't know if any of you have ever hurt your Achilles heel, but like the doctor told me when I went there, he said, you would have been better off breaking your ankle. It takes longer for an Achilles heel to heal than a broken ankle. So I was in this boot forever, and you should have seen me hobbling up and down these stairs, because third floor, they don't have elevators. People need to really, really think about where they want to live. And when you're helping someone find somewhere to live, and if they're insisting on a place that in your mind and in your experience may not work out for them, do an experiment. It's like, okay, you want to live here? Fine, this is it, you know? And then see how they feel afterwards. I thought that provider did an excellent job in letting them see beforehand what things might be like, because that member did change his mind about living on the third floor. Ask them, do they have any health needs or any foreseeable health needs? Okay. A person might be doing fine now, but you know, as we get older, our health does not get better. Newsflash, I keep telling people this, your health doesn't get better as you get older. And I'm a witness to that. I'm just very thankful that I'm healthy and I go to the doctor regularly, but your health does not improve as you get older. You have to take more time to care for it. Do you foresee that you may need a walker? This person may need a walker or even a wheelchair, you know, in the near future. Because where they're living right now doesn't mean it has to be permanent. This is just their first step. But, you know, just ask those questions. Do they need a first floor? Again, third floor. Some people may want the third floor, and that's great. Some apartments, I will tell you, I like what they're doing now, and you might want to ask this question. Say, for instance, a person has a service animal, and that service animal is a dog. And I don't care if it's a small dog, a yapper, or whatever. Once I was looking for these apartments for myself, this is not many years ago, but not too long ago. It was still, you know, within the last 10 years or whatever. I was thinking about selling my house back then and getting into an apartment. Some apartments, if you have a pet, you can only live on the first floor. And that is because they had so many people complain about the dogs running around all hours of the night. So all their tenants who had dogs had to be on the first floor. That was just one of their rules. So always make sure you find out, you know, what's most comfortable for the member and what is permitted as well. Do they want to live in a duplex? Some people, they don't mind neighbors, but they don't want too many. So find that out too. Duplexes are kind of hard to come by, but we do have them in North Carolina. Do they want a yard? If they want a yard and can't find, and that would sometimes you might think it just requires a single standalone unit, and they may want a yard because they have a dog. Well, how about a lot of apartments now have dog parks in them? They have small dog parks, or find an apartment with a dog park close by. They may not be able to have a yard. So you want to see how can we compromise? How can we make this work? Okay. When do they need to move? That's the next thing. When do they want to move? We have TCL, Transitions to Community Living, where a member is assigned a TC who is charged with the responsibility of helping that member find a place within 90 days. Okay. Sometimes that is the limit. But what if they're not TCL? When do you want them to move? Some people have a voucher. If they have a voucher, most vouchers, I think they used to be 90 days. I think now they're 60. I'm not sure. Alex, correct me if I'm wrong. But you got to get in there before the voucher expires, meaning if a person has a housing choice voucher, please look at the date. Please, please always be mindful of the date on that voucher, because you may think you have more time. They might tell you, oh, I have a voucher. I have a Section 8 voucher. Well, that's great. Make sure you see it. Make sure you put it in your file, because for two reasons. Number one, you need to know the date. Number two, there is probably a 75% chance that person's going to lose that voucher. They're going to lose that piece of paper, and you will always need, you'll at least have a copy. I always used to do that. Any documentation like that they had, I would say, do you mind if I copy it and put it in your file? And even they were grateful, because when they lost it, they can come back to me and I would be able to give them what they needed, okay? Whether it was a birth certificate, copy of the Social Security card, they didn't mind. I would get their permission, they would let me copy it. So I mentioned within the 90 days. Okay, so they might have to move within the 90 days. We're not just talking about new moves here. What if someone is already in a lease and they have to leave before the current lease ends? They've already, put in their notice that they're gonna move. So now they've given themselves, that's when the clock starts for you to help them find another place to live. If they do not move before that lease ends, they can ask for an extension. It needs to be in writing. Ask the property manager for an extension. If they don't put it in writing, then the property manager can give them a notice to vacate. You just don't want those kind of things on their record. Most property managers will give a notice to vacate. If you don't leave, then they'll do an eviction, a court eviction. So you don't even want to go that far. Always know you can make a request. I tell people, just ask. It doesn't cost anything to ask, and you're in no worse shape if you didn't ask. So sometimes people say, I just got to get out of here. I got to move as soon as possible. It might be a domestic violence situation. So be mindful of that. And then it also might be that some people don't know when they want to move. They have no clue. And that's where all your, excuse me, skills come in as a housing specialist, housing navigator. I'm sorry, I know they're changing all the names and titles of everyone nowadays. So whatever your role is, that's when okay, I got to help this person decide, when they want to move, if indeed they're even ready to take that step, to take that plunge. Some people don't even know if they're ready to do that. So that's where you come in to help them, those who are uncertain, okay? Oh, here's the good one. Where? Location, location, location. Location is everything. Everything. People think they want to live out in the country. Why do you think some of our members who don't even have a car want to live out in the boonies? Why do y'all think they want to live out there away from everybody? Take a guess. I'm a realist, so take a guess. And it's not to be walking around the meadows in the early morning dew. That's not it. What do y'all think it is? I know somebody put something in that chat.
Quiet, privacy.
Those are two very good reasons.
Away from bad influences.
Yes, very good.
Serenity. Somebody said SUD, less crime.
All those are true. What's another one? I'm looking for one more.
Another person said drugs.
Okay, can you elaborate on that? Drugs. To get away from the drugs? If it's to get away from the drugs, a lot of people want their privacy. Why do they want their privacy? I'm trying to be real honest with you guys about this. Everything you all wrote seems very sweet and nice and kind. That's not the world we live in.
People are also saying, illegal activity, drugs. It's easier to
Thank you.
use drugs. You won't be seen.
Thank you. You can have unauthorized guests in there. It'll be a while before the landlord ever finds that out, a good while, because they don't come out there often. You can have pets. Who's gonna know? No one's gonna know. All those other answers you guys gave are true, but unfortunately, the latter answers are more true. That's been our experience. So be careful, make sure, they can live where they want. And if they engage in these activities, and you know they're engaging in these activities, having people live there who shouldn't live there, or doing drugs or having whatever, all you can do is caution them. That's all you can do. And then you've done your due diligence. Some people want to live within the city limits. Some people want to live outside the city limits. They want to live in the country. Some want to live downtown. Some people say, I don't have a car. I need to get around. I got to go to the doctor. I want to go see my mom. And they need the public transportation. I've heard a lot that people want to live near their support system. So whether that's the provider office, it's their church, it's their family, that's where they want to do. That's where they want to be. They want to be close to shopping. These are all the questions you should be asking them before you start searching for housing, because you don't want to waste your time. You do not want to do that, okay? So then we're getting to the why. And by the way, you all, everyone, I know that I might be going a little fast, so please forgive me. We're trying to condense the trainings so that when you, other providers or anyone reviews them, they have less time to have to sit and watch the training. So please feel free to ask me any questions as I'm going along, okay? Please don't think you can't ask questions. Feel free to ask questions. Why? Why does a person want to move? Why do people want to move? This is where I'm asking for input from you all. What have any of the members given you as reasons why they want to move? And I don't know where they are when they tell you this, because our members are all in different places. Some of them are in hospitals, group homes, living with family, living in shelters. Why do they want to move? Have you ever asked the person that? Go ahead.
People, places, and things.
Yeah, exactly. They want to get around people. They want to go different, be able to do different things and go different places. Very good. Thank you. Any other reasons why they want to move? Anything in the chat, Alex?
Yeah, people are saying, things like maybe the neighborhood or the community that they find themselves in currently is not, it's not good, or they can't afford their current rents, issues with neighbors.
All those are excellent. And we get a lot of people who say they don't feel safe where they are. They want to move. So that's great. If they have that in them, that's their starting point. That's that energy. That's that motivation that's going to get them to participate in the process of them moving. Okay. A lot of people want to move. So like someone said, people, places, things, they can do what they want. They can have friends over. They can be closer to family. They can decorate things in their own style. We all have this style about us. I tell my kids I'm eclectic. My sisters will see that I like a piece of furniture. They'll say, well, does that match your dining room set? Or I don't care. If I like it, it's coming into my house. It matches what I like. And my sisters, they think if they got pine, everything has to be pine. I'm not like that. If I like what I like, I don't care what it is, it's coming into my house. So you get to decorate the way you want. They can't do that in a group home. They certainly can't do that in a hospital. So that gives people that freedom. They can make their own decisions. What am I going to have for dinner tonight? I'm a person who lives, I'm an empty nester, so I have no children at home anymore. And it's lovely, it's heavenly. I don't have to worry about something being too spicy because someone doesn't like this, or they don't like onions, or they don't like mushrooms. So I can do anything I want, make my own decisions. Lovely. They can be independent. It's nice to be independent. It's nice to have that empowerment, that feeling. So understand why they want to move. And some people like to play their music, although we do caution all of our members about playing the music too loud. That's why they make those little earbud things. I got a set of earbuds. I think I've had them now for 2 months. I'll start using them at some point. I don't know when, but my kids kept telling me I needed to get earbuds because sometimes I'll be in there. You know how we all sit around in the room, everyone's on their cell phones or whatever, and you want to hear a video? That's when I guess I need to use those earbuds. I got to start doing that. So what if they don't know why? Now, this is the part that I'm going to tell you that I train with the permanent supportive housing. So how about if you use what we call a payoff matrix to help a person learn why, or they may want or not want to move. So you want to ask them, what are the benefits of staying put? So let's say there's a person who is living in an adult care home. What would be some of the benefits of them staying put? And I'm gonna have to move along here. So I need you all to please just unmute and let me know, 1 or 2 people, doesn't matter, what are the benefits of staying put in that adult care home? Anybody? I got
Having
like
medication support.
a what? Tell me that again.
Having medication support.
That's right. Their medication, that support with the medication, they don't have to worry about taking the medication all the time, or remembering to take the medication. Someone's going to be there to help them and guide them and support them with that. Excellent. I don't even think I would have thought of that one, but that's a very good one. Anyone else want to say another benefit of staying in that adult care home? One more.
Food is provided.
Food is provided. You don't have to worry about cooking a meal. You don't have to worry about where your next meal is going to come from, do you? Very good. Thank you. Those are 2 excellent ones. Okay, so what would be the consequences of staying put? And when I say consequences, I know they can be positive or negative, but in this case, let's say, what would be some of the negative things about staying put? If they stay in that adult care home, what?
Less independence.
Exactly. Less independence and lots of rules too, aren't there? Lots of rules. One more.
Personal belongings being stolen. Could be.
Exactly. Yep. We hear that. We hear about that. And it's like my dad used to tell us when we were younger. I grew up in a household with 9 children and 2 adults. So there was 11 of us in the house. My father said he had 10 children. His 10th child was named Nobody, because nobody did it. Anything happened, a glass was broken or something was missing or someone ate something, nobody did it. Dad said it must be his 10th child, nobody, because none of us would fess up to it. So same thing in a group home. Things get stolen, things get missing, but then I guess nobody did it. Very good, thank you. So what would be the benefits of moving? What would be so good about moving? We just mentioned some of them a little while ago. And it could be the opposite of the consequences of staying. Someone said independent. You get your independence, right? What would be another benefit of them moving? And these are the things that we see every day. Anything in the chat? We're moving along here. Okay. I would say some of the benefits of moving is, again, we just said some of them. They can decorate the way they want. They can come and go as they please. We didn't mention that one. When they are in an adult group home, there are curfews. They can't just get up like I do sometimes at 1 o'clock in the morning and go breathe in the fresh air. If they're up and they can't sleep, you know how you can't sleep sometimes? I might even go sit on the back porch. They can't leave. They can't come and go as they please and do those kinds of things. So a benefit of moving is to have that independence that someone mentioned earlier. What would be the consequences of not moving? It's the opposite of the benefit. You're not going to have that freedom. You're not going to have all those things that you want to do. Okay? And actually, I'm sorry, I should have said, what are the consequences of moving? So forget the word not. What are the consequences of moving? The consequences about moving, they're gonna have to pay bills. Are they paying bills in the adult care home? Are they paying utilities? No? Yes? Anybody? They're not
No.
paying you. No,
No,
they're
they're
not
not.
paying you. They're not paying utilities. Are they going grocery shopping?
No.
No.
No,
Well,
they're
some.
not doing.
Yeah.
Some of them do? Do they really?
Yeah, they take
Oh,
them
that's
or they have
nice.
transportation, but for the most part, no, they have to create their own budget. Which is
Yeah,
something
and it's
I'm
good
not
though,
used
if they are taking them grocery shopping sometimes, that's good. Do they get to have, let me ask you all something, in the adult care homes, do they get to have their own, like if they buy something that needs to be refrigerated and stuff, are they allowed to do that kind of stuff now?
to. I know one that they can have personal refrigerators, like the small ones, but not like
Oh, in their rooms?
a dorm refrigerator. Yeah, some.
Oh, okay. Well, that's good. That's good. So anyways, you can use this payoff matrix in order for people to see what it is, what would be the benefits and consequences of leaving or not leaving. Okay, the big one, how? How will you locate housing? You guys, this is what I used to have to do. This was the only option I had. Survey the neighborhood, walk around and talk to current residents. I am so serious. I used to do this because I would ask them if I knew, I'm like, oh, do you own this home or you guys renting? I'd see them outside. Oh no, we rent. Who's your landlord? Is he a good landlord? I literally would ask those questions. And then I would establish a relationship with the landlord. I would get the information, establish a relationship. And when I called, they were more than willing. And sometimes landlords would call me. Natalie, I just want to let you know, I got a unit coming out. Do you have anybody? Because they knew I was going to be there as a support. Okay. I look for the for rent signs on the lawns. Everything's not going to be on Craigslist. And like you see the bullet down there saying, stay away from Craigslist. 95% of those are scams. And unfortunately, I've had members who have been scammed during the process of me helping them finding housing because, kudos to them for being independent and being excited about leaving and finding their own place, but they jumped the gun and gave money to a stranger online. And of course, the house would never belong to that stranger. So please stay away from Craigslist. But look for the for rent signs. People still do that. They still put for rent signs on the lawns. Contact landlords renting to other members to see if they have any availability. If you have a member who's already safely and successfully housed, check with the landlord. Ask them if they have any other units available. Okay, I already said stay away from Craigslist. Communicate with coworkers for leads. You have coworkers who have housed people. Ask them who the landlords are. This is all about outreach and networking with landlords. Okay, so Alex, who is my coworker who's on here, he's the TCL subsidy administrator. Ask him about the private landlords that rent to our folks. Okay, these are people who may have multiple units. I wouldn't suggest calling every landlord, just the ones who have multiple units, and you'd have to call maybe to find out, because some of our landlords only have 1 or 2 units, and those aren't the ones you're looking at. You want to try to connect with those who have more than 1 unit. Also, if you've ever done an ILI application, I used to be an ILI coordinator. I would send people lists of apartments like Schrader Properties. That is a property management company who they rent at a reasonable price, and they have units that they manage all over the city of Raleigh. So Schrader is one. There's another one, Rhine Management. They rent with pretty reasonable rates. Barker Realty. I would send them a list of all of these property management companies that rent units. And so you got to start establishing that network. Does anyone have any other suggestions on methods or strategies that they've used to find housing for someone that's not listed or that we haven't talked about that you want to share. And I know you all know about social serve, and like I said, Section 8, Go Section 8, and those kind of things that are a little bit more legit, but sometimes even on social serve, you got to be careful. Okay, so we will keep going, and I think honestly, that's the last slide. So are there any questions? Any questions at all? Any comments?
Sorry, Natalie, I was briefly away. I know as a resource for finding housing, Hotpads, Zillow, Trulia. Sometimes they have options too. I don't know if you mentioned those.
I didn't, but thank you. Yeah, Realtor.com, Zillow, Trulia, they actually, a lot of people go there to look for houses to buy, but there's
Right.
also a for rent section at the top. And you can click rent, you can put in the dollar amount, you can do it by zip code. Thank you, that's very, very good. You can
You're welcome.
find units there as well. Thank
And
you for that.
honestly, I was gonna say another one. Also, if you are not in Facebook groups or social media groups related to these items, get in those too. Because a lot of times that's where people will list their properties and things also for rent. And what's available also. Of course, you know, scammers are gonna scam wherever they're at. But
Right.
you know, those are also options. But like you said, getting to know and establishing rapport with landlords is very helpful. People are sharing, but like on social media, I've found a lot of resources just through that. Even reaching out to other not departments, but places you wouldn't expect, like the rescue missions. Like going to Oak City Cares. They sometimes have listings in their lobby, like the shelters and things like that. Wherever you might go that might just have listings, resources in their lobby, try theirs. I think social services sometimes have them. There's a variety of places that you can also go. If people are connected to school systems, maybe talking to the school social workers or counselors, they might have resources too. So you never know.
You, Joey. She's right. Thank you, Joey. And what we're talking about is legwork. It's going to take legwork. It's not just sitting at a computer. It's actually talking to people, calling people, going to visit. Each city, town has an association of landlords, and you can find out what that organization is in the area. They have meetings monthly. Invite yourself, call, see if you can come to one of the meetings, tell them who you are. Those are the kind of things you want to do. Wherever landlords congregate, that's where you want to be. Okay, and I've done that. I've gone to trainings that were intended for landlords, but that's where I met landlords. And I told them what I did. We exchanged cards. We're talking about legwork. So thank you, Joey, for that. Any other questions or comments before we end? Okay, well, thank you guys so much I hope somebody got something a little bit new or different out of this. And I hope you all enjoy the rest of your day. Thank you.